So I get asked this question quite a bit. Does breast cancer always present as a lump? And the answer is no, actually. There are different ways in which breast cancer can present. So let's go through them. So one of them is skin thickening. So what does that mean? Well, actually it means just that. It's thickening of an area of the skin over the breast. And it's actually quite obvious to feel. It'll feel a little bit different to the rest of the skin of the breast. So it could well be that there is something underneath the skin that is causing this thickening. But if you notice that, then do get it checked out. Then you have spontaneous nipple discharge. So this is more when it's bloody and unilateral or just one side. You should also get it checked out if you have clear nipple discharge. So if you notice it, especially on your bra or on your undergarments at night, then nipple discharge, get it checked out. Next, we have skin dimpling. So what's that? People get a little bit concerned about skin dimpling. Essentially what that is the skin of the breast is being pulled inwards, usually by a mass, a lump, usually a cancer. So the cancer underneath the skin within the breast is pulling the skin downwards into the breast, causing a dimple. And it looks like a dimple of the cheek. That is what dimpling is. And if you notice anything like that, you must get that checked out as well. Next sign to look out for that isn't a lump is nipple inversion. So this is when the nipple is pulled inwards, a bit like dimpling. The reason for this is normally, again, because there is a lump underneath the nipple that is pulling the nipple inwards. Now, nipple inversion is actually quite common. Many women have inverted nipples, which can be long-standing. However, sometimes if you notice that the nipple is going inwards and it's not going out at all, then that must get checked out. The next possible sign that isn't a lump is a rash, and specifically around the nipple areolar complex, or also the breast. The rash can be red, and if the skin is also thickened, there is also something that needs to be checked out. So a rash that isn't going away, get it checked out. Next up, skin redness. So a lot of the time, redness of the skin indicates an infection. But if the redness of the skin is persisting and it doesn't go away despite antibiotics, then please do get that checked out. As I said, the majority of the time, redness of the skin is an infection, but it needs to be checked out should it persist. And lastly, change in the contour of the breast. And what basically that means is there is a change in the shape of the breast. Now, when you look at your breast, you will be able to see the shape of the breast. And if you compare the left to the right, if there is an obvious difference in the shape that is new and unusual, then that also needs to get checked out. So these are some examples of signs and symptoms that may indicate a cancer that is not a lump. Now, of course, a lot of the time, these changes can occur and they are not cancerous at all. They may just be normal breast tissue or an infection, for example, or something that is quite normal. However, should you notice any of these changes that are, of course, new to you, then do go to your doctor so that you can get examined and referred to the appropriate specialist if necessary.